Hi, YouTube community. My name is Dr. Doeun Lee. I am a board certified endocrinologist. Today, we want to talk about hypothyroidism. So, if you or your friends, loved ones have hypothyroidism and they are having symptoms or their levels are not correct, then you should continue to listen in. So hypothyroidism you develop if you do have Hashimoto thyroiditis, or if your thyroid gland was removed, or we sometimes call it idiopathic. So you would develop hypothyroidism without really having identifiable causes. So let's say your doctor told you that you have hypothyroidism and you started taking the medication. Oftentimes, your symptoms would get better when you take thyroid medication, and your levels will normalize. When you take the medication, we look at the level called TSH, thyroid stimulating hormone, which is really not a thyroid hormone per se. It is thyroid stimulating hormone coming from your pituitary gland. So, pituitary gland thyroid stimulating hormone is like a thermostat. I like to uh, say that to the patient so that I can enhance the understanding how this works. So, it's really like a thermostat. If your thyroid levels are low, thermostat will turn up, crank up to get that high. And then vice versa. If your thyroid levels are too high, then your thermostat will crank it down to cool it down. So that's what happens to physiology. And what's really interesting is TSH, which is a thermostat, is extremely sensitive to thyroid hormone dynamic. So if your thyroid levels are a little bit low, TSH will go up sky high. And if your thyroid levels are slightly high, then your TSH will be extremely low. That is why we do rely on TSH level rather than T4 and T3 level when we're dealing with hypothyroidism. When we're dealing with hyperthyroidism, we do look at T4, T3, which I'll get into that later. So you have hypothyroidism, your TSH is normal, but you're symptomatic. Then you really need to think about other preparations. So that's what I am going to go into detail. So first of all, we do usually treat patients first line therapy levothyroxine, which is basically T4. Our thyroid gland does make T4 as well as T3 at a ratio of about 14 to 1. So every 14 molecule of T4 we make T3. So we also make T3 in addition to T4, but we generally start treating patients with only levothyroxine, which is T4, because it is stable, it is well standardized, it is very affordable. Patients tolerate this medication really well, and so we do start levothyroxine. However, some people remain symptomatic even though their TSH is completely normal. Some people do say that, oh, my TSH is normal, but my T4 or T3 are slightly off. Then I think you should also consider talking to your endocrinologist and talk about how TSH is really the standard measure of your thyroid hormone level. Like I said earlier, TSH is ultra sensitive to your thyroid hormone needs. Therefore, if your thyroid level is slightly off, T4, T3 may remain within normal range, but then TSH will be extremely abnormal. Therefore, um, if you do have just regular hypothyroidism, really we should rely on TSH only. If there is a discrepancy, it could be because of the fact that you're taking something different from levothyroxine, or it could be assay error. TSH is the most reliable thyroid measure. So, however, TSH for you, some people, some people feel better at certain TSH level. For example, some people really like to run TSH of 1 to 2. Some people really like to run TSH 0.5 to 1. Some people like to run TSH of 3 to 4. I personally don't really have huge preference, but when I have lower TSH, meaning those are high, I do suffer from palpitations. So I like to run around 2 to 3 is my range. And some people are less sensitive. They just really don't feel much different. And, they just like to have normal level. Again, hormones are very different in terms of below and above which you feel symptomatic. So individually differ. Some people have TSH level of 200 and do not have any symptoms. Some people have TSH level of 3 and they're like, Dr. Lee, I am dying. Get my TSH down to 1. So let's say, your range is normal as per reference, but you may not feel good because it's not your normal. So you might be feeling great at TSH of 1 and your TSH was 3, then you may need to increase the dosage. So if you are having issue with your primary care physician or other doctor about your thyroid, your TSH3, you shouldn't be symptomatic because it is normal. Then you could also switch to another physician who you can talk to. Because, I do acknowledge that some people actually truly do feel better when their TSH is close to 1 rather than 3 to 4. So that is one thing. Levothyroxine usually come in generic medication, and some people do feel better on commercial preparation, such as tyrosine or synthroid or unithroid. So those branded medication, especially tyrosine, seems to have very few ingredients. Actually, in fact, tyrosine has water and glycerol only, whereas other tablets will have other fillers. So it is the purest form. Some people really do like taking tyrosine for their body, just by philosophy, or some people just actually truly feel better on tyrosine. So you can try out some physician samples, and if you feel it's making a true difference, then you can consider switching over to this branded preparation. So let's say you did try T4 therapy, including branded medication, but you still remain symptomatic. Like I said earlier, normal thyroid gland do make T4 and T3 at a ratio of 14 to 1. So sometimes, due to inefficient conversion from T4 to T3, since we're taking levothyroxine, which is T4, and if you're not an efficient converter of T4 to T3, you might be having symptoms of low T3. Then you can throw in a little bit of T3 to your regimen. I would say about half of my patients to try that feel really, really much better. Their brain fog is gone. They do start losing a little bit of weight. Depressive symptoms is lifted. And so a lot of symptoms can be better. I do have a little bit of a selection bias because people who walk into my office usually do have symptoms when their TSH is normal. So then primary care physicians don't know what to do with them because they don't want to keep increasing the dosage because you do have risk of having osteoporosis and atrial fibrillation if your TSH is running low all the time. So at that point, I would say I will lower the T4 dosage a little bit and then add T3, usually about 5 microgram. Typical dosage would be 75 microgram of levothyroxine and then 5 microgram of T3, liothyronine. And like I said, about 50% of patients report huge symptom improvement, whereas 20% actually do feel worse because they do have palpitations from it, more anxiety symptoms from that. And 30%, they don't feel any difference. So After about 2 months of trial, if they are feeling worse, obviously stop it. No difference, stop it. There's no reason to take 2 different medications. But if you do feel better, I have them stay on it for about 6 months. And if even after 6 months, they do feel better on the combination therapy, then I would stay on the medication. Usually, placebo effect tends to last only about 3 months or so. So if that was because of the fact that you're taking something extra given by your endocrinologist and you started to feel better, it could be due to placebo effect. Therefore, I always evaluate again at 6 months to make sure it is not a placebo effect, because if it is, then there's no reason to take the additional medication. So that's the second. First is levothyroxine generic. Second is branded medication, Synthroid or Tyrosine or Liboxyl. Third line would be combination therapy of levothyroxine plus cytomel, liothyronine. And lastly, I do also try out desiccated thyroid extract. The name is like WP thyroid and P thyroid, Armour thyroid. I tend to use Armour thyroid most often because it has the largest manufacturing process, has the least supply issue, and most consistent. Problem with desiccated thyroid extract is that the ratio of your T4 and T3 is different from human because it is coming from the animal thyroid gland dried extract, and their ratio is 4:1 rather than 14:1. So you get a lot more T3. And the reference range for our lab from LabCorp, Hospital Lab, or Quest Diagnostics is based on obviously human. Since we are human and we're not bats, so we do have reference range according to human. Desiccated thyroid hormone extract is animal extract. Therefore, your reference range when you take that medication, your level will be slightly off from reference range, in that you will have high T3 and low T4. If you are trying to manage your TSH to be normal on desiccated thyroid hormone extract, likely your T4 will be low and T3 will be high and TSH will be normal. However, if you take higher dosage than your body needs, then your TSH will be low. T4 can be low normal, T3 will be frankly elevated. So a lot of times, patients who are taking desiccated thyroid hormone extracts, levels will be off. And patients, doctors, a lot of times don't know how to interpret that. And so they usually come to see me and I explain why that might be the case. Then, they have full understanding after that. So even though it is very simple explanation, a lot of doctors don't seem to know exactly how to interpret the data, and nor the patients, obviously. So I just wanted to enhance the understanding of thyroid hormone function interpretation. But also, I want to tell you, when we're in fellowship program, we were told not to really try out desiccated thyroid hormone extract because of T3 ingredients is just too high. But in my clinical practice, some patients really do like DTE much better than levothyroxine or Synthroid and things like that. So if the patients are feeling significantly better and your TSH is in reasonable range, between 0.4 and 3 or 4, then I really don't mind continuing with prescription of desiccated thyroid extract, assuming, they understand how to read thyroid function test. We just don't want to over prescribe it. Meaning overdose the medication, because the risk is basically you do get bone thinning, leading to osteoporosis and fracture and atrial fibrillation. So that's what we want to avoid. And as long as that is done, you're good. And so a lot of people do not want to prescribe desiccated thyroid extract because of their, endocrinology fellowship teaching method, but my thing is, if you're not harmed by medication and you're feeling pretty good on it compared to other preparation, I do continue to give that medication to the patient. So if you do have hypothyroidism and have further questions, please comment below and I will be able to answer those questions individually. Thank you so much for watching and I hope to see you in the next video. Thank you. Bye.